moving on to the next question. Our baby was diagnosed with a hole in his heart before birth. Will he need surgery right away, and what are his chances of living a normal life?
Sure. So this is somebody who had prenatal care and has had ultrasounds and recognized there is a hole in the heart. So just to simply say a hole in the heart, there is several areas in the heart that that can have that what we call as septal defects. They may be picked up in preterm ultrasound or prenatal ultrasound or not, but sometimes babies can have this right after birth as well, so they will require monitoring. Not all holes in the heart need the surgery. Most of them in fact do not need surgeries right away. Okay, so there's something that so the babies go through changes in pressures within the lungs and the heart sort of, so transition. So how their transition is important, how they're doing after that transition is important to follow. So follow up is important, but I would say like more than 90% of the hole in the heart, just if it is just that hole in the heart, it does not need support or surgery right away, but definitely needs follow up. It is also important to look at, like, are there multiple of them? Is it related to some other problem? Like, is the heart, both sides of the heart, well developed or not? So if they are associated with those things, then they need like a staged surgical intervention. But immediately after birth, most of these conditions don't need right away.
And doctor, for the parents of children with congenital heart diseases, what exactly would you say are like the pointers for caring with a baby, for a baby with a congenital heart disease, and about like counseling them about having future children? What are the chances of their future children having similar heart diseases?
Okay. When you talk about congenital heart defects, it could be like a 1 in 100. Okay. So it is screened very well. So, for example, here in the US, there is something called congenital heart defect screen. So there is something that we do, like at 24 hours of life, we screen them for, like, basically we're looking for oxygen saturations and ruling out congenital heart defect. So obviously, most of them are not picked up if they did not have, prenatal care. This has to be recognized after birth. Okay, so the ones that are recognized before birth are the ones that had good prenatal care, had the prenatal ultrasound that is flagging them that something is wrong and is followed. So in terms of the recurrence rate, it really depends on what kind of congenital heart defect we're talking about. So there is different kinds. There is like the cyanotic kind, the acyanotic kind, but I think it really depends on what we are talking about. There are several different ones.
Mhm, mhm. Thank you so much, doctor. And